I don't want to waste them. So I'd like to call the meeting to order. My name is Charlie Twait. I'm the CEO here. I'm also the CAC chairman. Oh, and here comes Rod, so that's good. What I'd like to do is first have everybody go around the table and introduce themselves so everyone knows who everybody is. If you have a sign-in sheet, that's good. So we'll start on this side of the table, make it easier for you. Like I said, I'm Charlie Twait. I'm the CEO here. Arvinder?
I'm Arvinder Singh. I'm the chip coordinator for Lake County, Lake Health District.
I'm Christy Alderson, and I'm the grant writer.
I'm Francie Winters. I'm the new prevention coordinator.
I'm Trace Wanzer, and I'm the interim director at the Wellness Center.
I'm Beth Hadley with Public Health.
I'm Maddie Bunton, RN here at the hospital and getting my bachelor's at OHSU.
Paul McGinnis, Greater Oregon Behavioral Health and the Eastern Oregon Coordinated Care Organization.
Alana Shamback. I am with the Eastern Oregon Healthy Living Alliance, and I run our school-based oral health program.
I'm Diane Clay, and I'm with the Lake County Food Chair and the Hospital Auxiliary.
Rod Harwood, older adult behavioral health specialist with Greater Oregon Behavioral Health.
And then Jimmy?
Jimmy Hall, Lake County Examiner. That's
Managing editor.
Managing editor.
yes.
Yeah.
Thank you, thank you. Thank you everyone for being here. So a couple things before we get really going. Do we have any special comments that any of the, I don't see any public that we know we have?
Did maybe someone?
No problem. Anna, do you want to introduce yourself?
Sure.
So I'm Anna Heflin. I'm with the Women's Ambassador Program,
Marvelous.
and I was invited to come today to answer some questions for you guys and maybe give you a little insight into my ideas and what I think maybe we should go forward with.
Excellent, excellent. Thank you. Welcome.
Thank you
And,
very much.
Darwin, you want to introduce yourself?
Darwin
Sit at
Johnson.
the table while you're.
Couldn't get to Jimmy's way.
And since you've been recently elected, you should tell us.
Oh, yeah, recently elected to the town council. It's appointed a little over a year ago, so that's just
Congratulations.
one of my separate things I like to do.
In your spare time?
In my spare time.
Yeah.
I'm, main job though is planning director for the county, which I've been doing for almost 6 years already. Coaching any sport I can, so I'm helping out with wrestling right now. Have a few kids. Join the cantata too, we need more guys out at the cantata.
Yeah.
Helping out, not
Yeah.
those that aren't aware, that's the choir that sings Christmas carols, right? Again,
Dr. Charlie, he can sing.
Yeah, I'm helping each other, come on.
You said guys, they have to be.
Did you say that you had a football team or for family or?
Yeah, almost football team.
Yeah.
No, it's good to be here, I'm just, doing whatever I can to help out the community.
Wonderful. We appreciate it. Well, thank you everyone for coming. First thing we want to do, we have some minutes in front of you. You could review them and if you, when you're ready, if someone would like to make a motion to adopt these minutes.
Couple minor corrections, Mr. Chair.
Oh, please.
So on EOCCO overview, third line up from the bottom of the paragraph, it says 93,000. It should be 593,000.
Yeah, a little bit of.
And then in the middle, the sentence that begins, EOCCO has not adequately addressed all of those measures. That's not true. We met the measures and therefore we got the 10.2 million back this year. At risk for 2017 is 15.7. Does that make sense?
At risk for what? At risk for 2017?
Is 15, yeah, what happens is the Oregon Health Authority withholds a certain amount of money and then they give it back to us if we meet the measures. So we met the measures for 2016, you know, and got the 10.2 back.
Okay.
But this year, I'm more concerned where it just says we did not adequately address them because we did and we met the measures.
Okay.
Thank you for that clarification.
You bet.
Do we have any other, modifications to the minutes? Hearing none, can I have a nomination, or not nomination, motion to accept the minutes?
Yeah, motion to approve the minutes as
Thank
amended.
you, Darrell. And second?
Second.
And moved in second, all in favor, please signify by saying aye. Any opposed, same sign? Thank you. And it's been approved. Let's move then to Rod, if you'd like to.
If you don't mind, I'm gonna stand up, I'm doing way too much in this job. Started this job on September the 26th, and found out from Tracy because that trauma. Started the same day with Goldie. Before that, how many of you know Eric Sorensen?
Yes.
I was kind of that in Pendleton and Umatilla County. So I started off as a chaplain there and became the director of mission services. And led the process for the past several years of doing countywide community health assessments. When people in the hospital needed to connect with people in the community, they would come to me, and then vice versa. I also coach as well. I coach middle school cross country and track. Just finished the cross country season. Had 60 kids in my middle school program. It's quite impressive when you show up at a meet and you have to come up in 2 buses with cross country. So I see a kid with 2 legs and I say they have to run. Seriously. I say, do you have a full sport? If not, you need to run cross country. And part of that motivation is for me, I have cerebral palsy and wore braces as a kid, had corrective surgery done, and then came to high school. A high school coach who also happened to be the chaplain said, come out for cross country. And at first, trip and fall every 100 feet or so, but got better, got stronger. Ended up doing well enough in sport I had to offer to run college. So that's what makes a difference if a coach and community can encourage and support. It can change a person's life, no matter what sport or what activity. And so you're all about prevention, those right there. So, older adult behavioral health specialists. The state of Oregon Health Authority recognize that we have a lot of older adults, and we're going to have more of them. Right now, it's about 15% of the population across the state. In Harney County, where I was just the other day, it's 25% of the population. Do you know what it is here?
It's about 25.
About 25%. Which 25% is what the state expects by 2030. Can you imagine where you're going to be at in 2030?
Well, it depends on if younger people move in or not.
That's true.
That's my big fear for some of our counties.
You're fearful that they will or will not?
Will not. I mean, we're not replacing our population, that's for sure. That's a first.
So, whatever the case, we have older adults that, as they get older, have health needs, whether physical or behavioral. And they have found out, they see that 15 to 20% of all older adults experience depression. So, every 5 older adults that you come across are experiencing depression. In addition to that, you know, if you look on the statistics there, you have men aged 75 or older have a high rate of suicide. Up to 15% of older adults are at-risk drinkers. Up to 23% deal with prescription drug misuse. And that can be a whole variety of reasons. If you ever sit down with an older adult that have 5 different prescriptions, that could be a challenge right there. So, another statistic that you do not see there is we have just as many older adults dying from social isolation as we do tobacco use. And again, there can be a whole variety of reasons for that. But that's a terrible statistic. But as we think about that, we can probably think of a lot of individuals that fit into that category. So the state, one of the things that they recognize though too is we have a lot of wonderful agencies, and that's one of the benefits I've had as I've been traveling is I meet the representatives of the various different agencies, the area, the AAA, the Area Agency on Aging, the Aging and Disabilities Department, the hospitals, the nursing homes, the whole variety of hospice, home health, the whole range of faith communities too. We could go on, that all care about and serve our elders in our community. And at the same time, we have, with all these great agencies, siloing going on, a lot of not knowing what this group does or how to engage that group. So they decided they should have an older adult behavioral health specialist that can help bring about that collaboration. Now I know in rural communities, there's collaboration going on all the time anyways, but still, as I've been going from community to community, I've been hearing from the stakeholders in these communities, it would be great if we could collaborate even more together. And if there's any way I can support doing that, or if you want to initiate that, whatever that community needs. And so far they say, go for it, initiate it. And so I've been getting a hold, identifying who the stakeholders are in the community. And so my plan is to then form an older adult collaborative, health collaborative in each community, where we can understand what each other's health needs, what each other does, and bring to the table those systemic issues that keep on hindering us caring for our elders, and addressing those together. We don't necessarily need anybody over in Salem or anybody else to do that for us. We still need some assistance there. But I know, I grew up in a rural community in South Dakota, 60 miles from the closest town, one-room schoolhouse. My dad taught me to always figure it out. And I know in the rural communities, they figure it out. And so I've seen, I chaired the LCAC in Umatilla County for almost 4 years. And when issues would arise, when this became the place, what we hear from the consumer, what we hear from the members, and when those things would be brought forward, 9 times out of 10, they were solved right here. We didn't have to bump them up to the ELCCO or to the OBU. So that's what I hope to see in collaborative where that can take place. Also where we can maybe pool and do education together, educate each other, as well as part of my job is to help provide complex case consultation. Fortunately, you don't have to rely on me alone. I'm so thankful for that. We have, I'll have referral forms which you can fill out, and we have a team that that works on that, psychiatrists and others, that when you present that, we make recommendations and discuss what's the next best step with that person. And we're developing other forms of case consultation too. I know MODA's taken a lead in that for this region as well. So that's part of what I'm doing. In your handout here, the last document, you have 8 modules. There, I think everybody has it. There. Oh, they do? Yeah, here you go. You have 8 modules that PSU has put together that I can bring to the community, and I can come to individual agencies and present these. However, what works even better is maybe through a collaborative or through some sort of joint activity, having several representatives, several agencies in the room, because on these different topics, yes, there is the presentation, but representatives of those agencies in the rooms are the best experts on that topic, and it can be shared here as well. In addition to that, as we identify additional educational needs for caregivers, but also for community members, as a collaborative, we can work on doing that. Now, my understanding is the CHIP, part of the areas you're working on is older adult health, right? So that's where that collaborative can even maybe possibly focus in on that and work with this group as well. Because several of you would be part of that collaborative. Now, it's important to understand, this is not just for Oregon Health members. It's for all older adults. You can be on Medicare, you can be on the Oregon Health Plan, you could be on, they're saying like 60 and above, but also any adult that is on disability, has a disability, can receive support through this. Thoughts, questions?
How do they find you? Where are they gonna find your information around town?
Where are they going to, well, that's through the collaborative. One thing, I've been, yesterday and today, I've been reaching out to several stakeholders in the community and passing out this type of information, giving them my business card. I have this many business cards left. They gave me a whole pile a little over a week ago. This is how much I got left. But also on here, you can see my contact information. And again, that's working with the collaborative. That's how they can reach me too. But does that answer your question?
I hope so.
Okay.
Well, Rod, there is, and Christie, help me out. I mean, what you were asking about, in the CHIP plan, we did include working with the faith community and trying to deliver mental health first aid to congregations, which kind of mirrors the regional CAC issue. I mean, so coordination there with Rod can happen too, and that's different than the resources that John Adams has for school teachers and law enforcement. But Gobi has trained mental health facilitators, so coordinating that activity through them would be good.
And my goal eventually is to receive some of that kind of training myself too. But yeah, and you can work with me on that, but also then we can work with our faith community. And again, I think probably Eric is a great resource for that. I know that, I know in my own community, I fill pulpits all the time. Now through the end of this year, I'll be speaking in 2 churches every Sunday. But I'm not here. But that's again, those relationships you end up developing, you're able to then go in and do those things.
Rod, for example, if somebody at the senior center presents and has a need, and Andrea says, maybe we could get you some resources. Would Andrea call our mental health service, or would they contact you?
Well, it really depends upon the case. Sometimes, as you get to know what your other stakeholders can do, you don't necessarily need to call me for that. You can call Trace over here, and says, yeah, we can. That's what we can work on. However, at the same time, if you don't know, you can call me, and then it's part of my job to ferret that out. That makes sense?
Well, one of the questions that came up in Harney on this, do you know if the Wellness Center is billing for Medicare services?
I don't believe so.
Yeah, neither were they at Harney. They were just eating those services as part of their
As of
obligation.
August 1st, since the Wellness Center is now part of the district, it can bill Medicare.
Well, they all could, they just never did. It was an administrative burden, and I think it was because they were mainly funded through the Oregon Health Plan. now with the expansion of this, it's certainly something that the CMH, the community mental health programs across the state need to get on their radar. And just to go back to what we were talking about with the mental health first aid, really though, the evidence was saying that older adults, not only do they not recognize it, because you remember when we did the household survey here, you know, when we asked the 2 depression questions, 30-something people, 30-something% of the people answered yes to the PH2Q, you know, that basically they've been depressed or, and then when we asked, do you have any mental health problems, only 6% said yes. So they weren't, there was a disconnect there. But they would, the evidence says that it needs to come from, they'll take the advice on somebody from the religious sector or from their peers. So that's where that training, if we train people in mental health first aid, then they're more likely to help one another, and if the message comes from the faith community, they're more likely to act upon it.
And I know a lot of ministers who, you know, they just don't know who to connect with. Again, it's having that personal connection, because they don't necessarily send somebody off to the mental health facility, you know, and that's the whole stigma thing too. But if they know Trace has come by and seen them, that's a whole different deal. It's building relationships. That's in part like, that's why I'm here. Again, with the Oregon Health Authority, they determined one of me or one OB for every 30,000 older adults. Now, if you go to the west side, that means they sometimes have 2 in a county or 1 in a county. You go to the east side, when I first started, they assigned me 6 counties: Union, Wallowa, Baker, Malheur, Grant, and Harney. And then, as recently, this county came open, and I said, okay, I'm in Hardy. I'll do it. You know, part of it's because I have a real passion and a heart for rural communities. I know how important it is that those communities get the services that they deserve. Because I've been on the other end, growing up all my life, being neglected that way. So I really want to make sure. That's why my goal is to be down here at least once a month. And that might not sound like that much, but most of the places I go to, I can make it into a day trip. But with Burns and now Lakeview, what I'm doing is I'll be coming down like on a Tuesday. They have their advisory council meeting then. I'll be connecting with the stakeholders Tuesday, Wednesday, possibly have a collaborative on one of those days. Come down here Wednesday afternoon, and Thursday here, and then I get to head home on Friday. And I told my wife, it's just the way it's going to be. She's a 2nd grade teacher, and she said she may have to get a revolver. I said, just make sure you don't shoot me when I come back to the car. But you know, anyway, speaking of mental health first aid, at the very beginning of the school year, they brought that into her school. And like most teachers, they're just overwhelmed with starting school and having to get ready for all their students. And on one of their days they normally had free to work in their classroom, they had this in-service day where they had to do mental health first aid. She was griping and complaining to me about, why are they doing this? And I said, no, it's good, it's a good thing. After she took it, she said on so many occasions, it was really good training and she would appreciate doing it. Now, if we get 2nd grade teachers being familiar with that process and how this is just a normal part of life, and if we get our faith community leaders doing the same thing, I know in Umatilla County, I keep on saying, hey guys, ladies, take the class, we can reduce that stigma. I think I probably took more time than it was a lot of. Thank you for letting me come.
Thank you.
Thank you very much, Rod. Any questions before we move on to the next? If not, thank you. Arvinder?
Yeah. Good afternoon. We had a listening tour earlier this week with the representatives of the Office of Rural Health and the Oregon Health Authority. I wanted to try and summarize the issues facing the health system that were brought up. We discussed the barrier of lack of resources that is faced in most rural communities. And by resources, it doesn't only mean shortage of equipment, space or funding, but also personnel. Rural communities usually have a difficulty to recruit providers, nurses, and any skilled personnel. Once we do get the personnel we need, they have a hard time making a rural community their home, due to which we are afflicted with a high turnover rate. 20% of our knowledge base leaves annually was the statistic that was brought up. And if anybody has any comments, please do chime in. Another issue that goes hand in hand with the lack of resources is the lack of support system. Rural communities have a shortage of social support services, such as emotional and informational support, like substance abuse support, alcohol and drug abuse support, transportation and emergency medical services. Our residents shouldn't have to leave their towns to seek these services. I remember Charlie making a comment that to say we have a home health and hospice, but we probably only have a hospice. And but now that we have the wellness center, I guess we can take care of some of these support service issues. Next, we need to build on the relationship between community and the healthcare system. Rural communities have more methods of, we should have more methods of spreading education and knowledge to our community. Because of the isolation that is prevalent in rural communities, we also face a unique problem of many who don't know and don't know how to ask. Then we also discussed the limited healthcare options we have. And we were discussing that a couple of years back, families with the Oregon Health Plan had to go outside Lakeview to meet dental needs. Now we do have Advantage Dental, but I don't know if other places in Lake County have similar options. Then we also discussed that we have a lack of activities for children and adults. We don't have any after-school programs for children, or a safe place or a sober place for both adults and children. I was at Harney County a couple of days back, and I noticed some skating and skateboarding ramps over there, and I have seen quite a few people in Lakeview who skateboard, and that's just one of the things that came to my mind, and I thought I'd just throw it out there. Then we also discussed the data shared at state level is not an accurate representation of the health in rural communities. We have high scores for infant mortality rates and a high suicide rate, but due to the small size of the communities, the percentage fluctuates wildly, which larger communities probably do not face. So we had asked them to suggest a different method to track state numbers. However, the EOCCO numbers represent only the rural communities and are accurate. Does anybody have any comments?
The data shared, you don't have access to, like, we have at least youth data at a county-wide level. There's no adult version of the same kind of thing? Not that I've seen.
Anybody from the health department?
From the health department. I don't, what question are you asking?
Well, it says data shared is not accurate representation of, they only have Oregon data. They don't have it separated by county.
Oh, we have all
We do
kinds
have
of
county
data.
data.
Okay.
We do have
The
county
problem
information.
Is that with our numbers, 1 or 2 people can skew the data.
Right.
So like with the suicide rate or something, if you have one more person commit suicide in a year, that can change the rate dramatically. So that's where it's really difficult in a rural community to know if what the data is showing is very accurate. And what they have done, sometimes I know for some of the tobacco data, is they combine counties in Eastern Oregon, and they split it out by county, but then they'd also show what the percentages were combined for Eastern Oregon counties to give a little bit better feel, you know, and because our data is different than the west side. So they have done that before, but it's really hard sometimes to put much faith in some of those percents because it can really change dramatically.
That, and, you know, our kids don't do that, it's the Harney kids that do that.
Right?
You match us up with Harney County, it's not our kids, they're the
That's
ones
not-
that are really.
Yeah,
Yeah.
those kids in
Yeah.
Burns, they're terrible.
And there are a couple of statistics. The reason why we brought up that issue, that it's hard to get good information. An example is we suffer in Lake County from what is considered a high percentage of low birth weight infants born in this county. So to put that into perspective, it's based on per 1,000 deliveries. We have 70 deliveries a year in the county. 1,000 deliveries, that means it takes 8 years,
More than that.
more than that, to get that 1,000.
That only gets us 700.
That's right. So if you're saying it takes,
Okay.
you can see how it can take several years to get that high birth weight or low birth weight delivery. So for those of you that don't know what that means, it's considered a low birth weight if they deliver at term or if they would have been at term less than 5 pounds. So if you had a child who was born at 5 pounds, but they were a month early, they would have grown had they stayed for the extra month. And so they wouldn't have been, this is delivery at term. Well, it's a consequence, because our numbers are so small, it's hard to use those accurate information. We have the same issue in the hospital. When we look at the number of types of things that we don't want to have happen, where, say, someone comes to the hospital and gets an infection we had not planned on, or if they fall, we track how many times people might fall. You know, those are things we don't want to have happen to somebody. But our numbers, if we only have 2 falls, well, it may sound like not much, unless you're that person that fell, then it's an important number.
Right, but when you turn it into a rate, it looks like everybody's falling all over.
20% of
Yeah.
your patients are falling in, that's not good. That's the problem with the data, and that's why it's difficult, I think, in this community, and like when we write grants, and when they're just looking at statistics, I think it's really hard. You have to look at that data, but I think you really have to think about how accurate that really is in the community. And like with the low birth weights, we also have a high tobacco, maternal tobacco use rate. So that that probably is true. We are probably doing higher low birth weights than other counties, but you just kind of have to look at the whole picture, I think, and not just focus on that, because it's not that accurate for small populations.
But the other important part about that is as we're trying to create plans to deal with those issues, sometimes we can get confused because we think, oh, we've got to do something about low birth weight because it's out of line, or our suicide rate is too high. Well, that may not actually be the biggest issue. It makes us look at the wrong place. That's one of the big things we try to talk with the health authority about, is as they're thinking about, as they set policy, how do we, when you look at statistics, don't misunderstand what we're all saying. We're not all drunks, we're not all killing ourselves, and we all don't have low infant birth weight.
Curious, when you did your assessment, did you have community meetings where you got feedback from the community? Yeah. And what did they say as far as that?
You know, we got lots of really good insight. Paul and the Office of Rural Health, we had a lot of really good help. And we're coming on the next go-around to try and do this again. And our vendor will be helping us go through that process. You know, and it was identified last week that in our survey for the community mental health provider survey that we had, our detailed analysis of the needs of our community from a mental health standpoint wasn't as specific as we'd like. So there are certain things that we've got to do to help direct us on what kinds of areas we can focus on.
Are there any suggestions of what we can do to increase the activities for children and adults? I'm sorry, I guess this is gonna happen tomorrow. Wow. So does anyone have any suggestions of, yeah, Rochelle?
Well, I was actually just with Sandra Rootner from OSU Ascension. She was all like 4-H work, which I know is a great youth program here in town. But we were just talking about trying to collaborate in the spring for some cooking, garden-based, after-school club type things for elementary school students. So I don't know if that's like the age group you're trying to hit or if it's more like high school.
I guess anything,
But
but would we be able to do those activities during the winter months?
we're
We
thinking
have to
like
do-
February, March. If it was cooking, then, you know, do indoors. But
And isn't JV starting some kind of another after-school team thing, something? I mean, I was over there the other day at the office and they were talking about that. Is that premature to mention?
I'm not sure. Yeah.
Oh, okay.
I don't know.
I'm surprised in that, because I feel like for the size of this community, we have a lot of stuff going on for kids.
Well, I think they specifically mentioned if you don't participate in sports.
Yes.
Oh, okay.
And that's
Yeah,
always
So
the
then
truth.
there's
Yeah.
not as,
Yeah,
well, I
sports
think
is
we
big.
did, I hope I'm not mixing it up, but like the sober place is what they, wasn't that the term?
Yeah, that was.
Yeah.
Yes.
And it's not that we don't have it, or we don't have active, we have churches that are very active, and people that go to those and participate in those events. That's absolutely fantastic. What we don't have is places that accommodate those that don't participate in church, that don't participate in sports. They don't have a good running, well, we had a good running coach, sorry, but now that this running is over, now what else can they do? And so that's one of the great things that Anna can talk
I'd seen one time about a program where they had collaborated with the senior center, and the senior citizens did after-school program for kids a couple nights a week, and they would help them with their homework and then do a craft or cook something or whatever, and it was great for the seniors because that helped their mental health and to be involved with the kid, and it was great for the kids because some of them don't have that one-on-one
One-on-one,
adult
yeah.
contact at home.
Like part of the mentor program.
Yeah, like that, but specifically for, and like for kids could walk to the, say, the senior center
Yeah,
and have, you know, not every night, but, so it's not like a babysitting program, but it's like a couple nights a week.
Yeah.
And the key is from right after school until when parents get home. That would be the most important thing, because I would even tell my assistant coaches, they have kids that weren't necessarily gung-ho on running. I said, we're providing a safe and healthy space for these kids to be in, where as mentors, you're teaching them to believe in themselves and teach them how to set goals and go after things. And that's where older adults can be involved in doing that.
Yeah, and I think
Whatever
you're right
activities
about
they
it
are.
has to go till work ends, because if it ends like at 4 o'clock and the parent gets off at 5, they're gonna say, my kid
Yeah.
can't do that because I don't have a way to get them home.
Plus the kid gets in trouble more. But if you can have a program that way, you're getting the adults involved, but also having a place for kids to be involved.
Well, that's why they have so many, I mean, that's why after-school, latchkey programs are so popular, because a good program is better than even going home to a parent who is not as involved.
right.
But it's a lot easier to get grant money for a program that's already sort of in place than it is to create something brand new.
Yep.
So if the extension, if the OSU extension is interested in doing something after school, and then we have another agency that does something after school, we might be able to fill up or at least come to a certain close to that, or you could offer something like that as a stopgap, and then as you wrote the grant to say, look, this is working, this is going to get this many kids or something. Obviously, this is in
It's
the,
measurable, plus if you show that it's collaborative, you get a
Right.
better chance of
Yeah.
getting money.
yeah, and obviously prevention activities for children and adults, and that's certainly You know, where I come from, I've worked in rural communities a lot, and it's very hard oftentimes to get the kids that are involved because they're already involved in the sports. So, you know, sometimes we had to try to get them only during school time, and the school had to let us in to do that. But then there are other kids that just don't fit that and still need someplace to go and something interesting to do. And a lot of times those are very creative kids. Statistics show that kids that get involved with juvenile probation and stuff are more often, you know, right-brained. I mean, I know that that's been, the right brain, left brain thing has kind of been thrown out, but that's the best way to talk about it still. They're the more, you know, creative, out of the box type thinkers. So if we can create programs for them, I feel like that's kind of our mandate with prevention if we are able to. So I'm kind of looking at all that.
Anna, you had a comment?
I do, and I could explode right now. This is my passion. It's why I'm here. It's why I volunteered for the women's program, not knowing that we got a stipend. So I have to say, when I found out we got a stipend and I only had a small tank of gas to get to Bend, Oregon, I was really excited because I was going to network with other people that were going to bring information back to the program that I was doing. I moved to Walport. I packed my kids up and left Lakeview because there was nothing for them to do. I did not want to end up with children that had alcoholism, drugs, and I was not going to be related to anybody that had those situations and all of that dysfunction going on, as well as the dysfunction that I've been through while I was here and what I've experienced, and it's been pretty deep for me. I raised my kids. I took a 12-year vacation, and then I looked at my husband and said, it's time to go home. We have 4 elders that we need to take care of. We have brick and mortar that we need to take care of. We have things we need to handle. We have responsibilities. I'm an only child, and we need to go home. So we did. I've been here 1 year. I passed forward my due diligence to 2 of those elders. One of them passed away and blessed me so wholeheartedly that you're gonna have to excuse me if I come to tears. Blessed me with a house and a car, and the ability to be able to stay here and be a part of this community. A couple other situations have changed for me where I found myself without a job, without situations that I didn't know how I was going to go forward, so I'm making my own business, my own situation. As we speak, in the last 2 months, I've had to change everything to make it happen. In the meantime, the Mentors program and the Women's program and the programs that are here that I'm able to reach out to and the people in the community have given me the strength to go forward to do what I need to do to make it happen. So what all of you guys are asking for, if I had the financial backing, I would already have that building, those programs going, and have it happening. When I went to Walport, I took on 5 after-school programs, and I taught all 5 of those programs with those children. And I was a teacher when they came and said, these kids won't do anything. Don't worry about him, just put him in the corner. It made me very angry. And every one of those children were my top kids in my class. Every one of them had projects that were completed. Every one of them had self-esteem and self-worth when we were done, because every one of them counted. So it's not about financial for me, it's about making it happen for the children and all the ones that are falling between the cracks. I'm working with moms right now that have just lost their jobs. They're single moms. I had one I had to work with for 3 weeks to get her into mental health because I knew she needed to get there, but she didn't want that stigma. She didn't want to have to go to mental health. She didn't want to get her kid taken away from her. She didn't want to be labeled crazy. She didn't want to be on medication. We work daily. She will call me at 3 o'clock in the morning. She will text me. I'm working with her. I've got another mom that's a single mom. She's got 3 kids. She's working with a dysfunctional dad with these 3 kids. The girlfriend that fights with her, she's got a regular job. I just got her an online job. She's trying to figure out childcare. She's got dysfunction in her family. She has nobody to watch her children. She can't afford to pay for childcare. And it's just a big vicious circle. So I try to plug in and get them and network and connect with them any way that I can. I see us being able to have a building. Where we have that building, we desperately need office supply. That's one thing that we need. That's a way to fund this whole situation. Put the office supply at the front. Give 4 of these women an opportunity to work and earn that money. Through that, have your workstations where you have your creative people that can come in. She can come in and work on her workstation. She's got her little front right there where she can sell her things that she's made. Whoever works at the front counter during that time makes that. I just see a program that can go into itself over and over and over again. Create jobs, bring the children in, help these women, show them how to take care of their children and how to work with their children. I could talk for hours, and I don't want to jumble it all up, but that's my passion, and I see that I had access to a building. This is what I've been doing for the last year. We were supposed to get a program in the Masons building. The Masons were going to give free rent, I believe, for a whole year. We only had to pay power, not, I don't say we, but the people who were involved only had to pay power and water. My understanding is that that didn't go through because of insurance purposes and liability. I'm sorry, I went and created with another business person. We wanted to work with some nonprofits. It didn't work out. I looked right at her and said, we're gonna do it anyway. We're gonna do Santa's Workshop. We had 42 confirmed kids last Saturday. We put it together on a whim. I purchased somebody's old craft room. We took that and donated it, made things, well, age groups, and then put those age groups and we'll make either decorations for the trees or we will make presents for their families. We also took on 3 trees for the Festival of Trees, where we would decorate those trees and give them back to the Festival of Trees from Santa's Workshop. Parents have to come with the kids. They sign a liability form. The Memorial Hall, the courthouse gave it to us for free. So from now, every Saturday through December 15th, parents and kids can come, bring their kids, make some sort of a craft, get together and network. We basically had Mom's Club with 2 and 3-year-olds. It was awesome. You know, we got some crafting done, got the paperwork done, but we got networking done. It was amazing. We had 3 people that really tried to tear it down and pull it apart and be negative and toxic, get all over Facebook, and I stopped it. I just said, we don't feed into this. This is not what we do. If you'd like to come down and see what we're doing, come enjoy it. If you don't, and it doesn't resonate with you, please stay home. No worries. It's my rules. I'm not under anybody else.
Fantastic thing that he Group is doing.
Yeah.
We'd like to learn more about that.
So,
And so maybe one of the things that we could do is give, maybe you might be able to talk with Jimmy a little bit about the story in the paper, but.
And Jimmy's been awesome for everything that we do. He always shows up.
He is excellent and really concerned about our community. We thank you very much for that.
Yeah.
And thank you for letting me go, because like I said, I could go 4 hours.
Brandon, did you want to continue on with a couple of other things that you?
Yeah, I'll go to the chip updates.
Okay.
No, that's perfect.
So first is the oral health program. These are the service dates for the year. Currently, we have the dental screening program being conducted in our schools. Yesterday, we set up 3 dental units at the Dally Middle School and ADA Fremont, but we did not see a good turnout. One of the reasons, I think, was reminders were sent to the parents. So the registration had happened around 2 months back, and I spoke to the principal, Susan Warner, and at length, and she reiterated that reminders is an important piece for the success of the program. So last night, I sat and called up to 100 families, because we have like around 150 to 170 consent forms. So I called up 100 yesterday, and I left many of them voicemails, and some of them I got directly in touch with, and I reminded them that this program that you have signed up for, so please show up. So the window of the oral health program is that we were gonna treat from 4 o'clock to 8 yesterday, and then again today we are gonna be there from 7:30 in the morning till 8 p.m. So they said, okay, thank you, and we didn't know, so we will try and make it tomorrow, and thank you. So, and then today I called up 70 families who were supposed to be seen yesterday. So we are hoping to have a better turnout today. And also because Lakeview is the only town in Lake County which is conducting these oral health programs during the parent-teacher conferences. I guess we were anyways expecting the numbers to dip, but not to the amount that I saw yesterday. So I'm hoping I'm going to go back after the CHIP meeting and see what's going on over there.
What I've been hearing from the other counties is that's a common problem. And the challenge to get those consent forms signed by parents, they go in the backpacks, they go wherever, they never end up, parents don't see it. It takes a lot of continued communication for that to break through.
I think the issue here is that it's during parent-teacher days, that they're not in school. I mean,
Yeah.
you were up at the Harney CAC and you saw the numbers. I mean, the consents were what they were, but if they consented and they were in school, they got the service.
Yeah.
You know, if the kids aren't in school and we're expecting them to come in for something, I think we're gonna, I mean, we learned a lesson here is what happened.
You won't be there.
Yeah,
And I've also had meetings with the principals of ADA and Dally Middle School, Jesse Hamilton and Susan Warner, and also the superintendent, Bill Cahill. And we have planned to meet probably the first week of December and discuss, because I think in the past there has been some problem with the CHIP program and the schools.
yeah.
So I don't want to just order them and tell them that we need to change from the conferences to regular school days, but my idea was I'll have a follow-up meeting, we'll discuss how the program went, and I'll show them that the numbers aren't that great and if we can change. And I also made these pamphlets. I thought probably the parents, we could probably give them an idea about the benefits they would be losing out on if they, because this program is like free for them at their doorstep. And also if you get a sealant done, you can forget about those teeth for like close to 5 years. That's what the American Dental Association says. So it's definitely something, a really good opportunity. And so I made pamphlets, and I was also passing it around to parents, because we were having these parent-teacher conferences at the same time, so there were many of the parents who were going for the conferences and they weren't coming for this screening program. So I gave them pamphlets. I was like, just have a look, and if you want to contact, all the contact information is there. So hopefully that works. And Mindy couldn't be here. She'll give us a better update in the next CHIP meeting. She told me still the Adel and Plush dates haven't been confirmed. But we do have another session next month. And yeah, she's at the school at the moment. Next, coming to the Women's Health Ambassador Program. I got Anna Heflin, who is one of the most successful ambassadors in the Women's Health Ambassador Program, and I wanted to know if you could share something about the attendance, and also if you think it's made a difference to the people who have attended your program.
With the attendance, I end up with anywhere from 4 to 6. What I find is that a couple of times they've canceled for different reasons, and I'm there with the food and drink, and they have not been able to show up, but maybe 1 or 2.
Okay.
So our outlook was whoever needs to be there was there, but at the same time, people couldn't be there, didn't mean they didn't want to be there, they just weren't able to show up, something came up, they still wanted to participate. So it was my idea to put together binders, and I put together binders for everybody with all of our information in it. That way, if they've missed the class, they have the information there, they can come to me and get the new information for the next class, and we can go over one-on-one. If they've got any questions, they can call me. And like I said, I'm an open book, so I'm open to anybody in my group or anybody that needs to contact me or call me and let me know what their situation is. For me in particular, I have a lady who was very inverted. She was didn't have a lot of self-confidence, but had a lot of skill, neat woman. I've watched her come out. I've watched her start doing her business. I've watched her get her things out into other businesses. She wants to participate. I could see her trying to be an ambassador next time if that is an option that comes open. I have another young lady that's grown with me. She always offers to babysit at our meetings. She shows up, she's there. I asked her the other day if she would be interested in doing this or being an ambassador or encouraging other girls. Did she get something from it? And she kind of hesitated for a minute, but then she said yes, because she did get enough out of it that if she could work it around what she's already doing, she would engage because it was important to her to have that resource. So I've seen different ladies, but not as a group section. It's been more of a one-on-one as they needed to reach out and get the information, and the information was available to them to be able to grow their self-esteem or to be able to grow out of their dysfunction or to be able to be more comfortable about coming to group sessions and just getting out and being able to meet people when they don't go to church and they don't go to the bars and they don't. There's that whole group of people and that whole group of children that have that. There's nowhere to go and nothing to do. So if you can collaborate that by small groups and different things, this is kind of what I've done with my groups.
So if we plan to continue the program, what would be your suggestion that we need to reduce the number of ambassadors from 9?
I would say probably 9 to 4, honestly. If you're going to use that money, put it back into the groups for what you're doing in classes and like when I go to Bend and I talk to my women network working group, they're willing to get online with me and have a live class or a live webinar with these girls and answer questions or share health information or different things like that. So we have opportunity not just to work with people in this community, but through the online opportunity, we have that to work with other people outside our community. And I've gotten a big response at Women in Financial Services or the different places that I go and Bend when I network with these women and I see them there in health. I say, would you talk to our class? Would you help us have a webinar? Absolutely. Can I give you my flyers? Can I give you my information? So I've got a great response that way, and that's what I'd like to see happen. I'd like to see it happen to downsize because they didn't have this big of a turnout, but offer more classes, offer more opportunity, offer more information.
Well, thank you so much.
Thank you.
So the next is the Youth Health Advocates Program. So we reached our deadline of teaching a class in October. So both the schools, the North Lake School and at Lakeview, we had 4 advocates each. And 2 weeks back, all the advocates conducted the classes. So we divided the 4 advocates to pairs, and they teach 2 classes. And I guess the attendance was up to 20 students to 10 students for North Lake, and for Lakeview, I myself attended one of the classes, and in that, the attendance was again up to 14 students. And the lessons are on their way. We're gonna provide them with the new lessons for the month of November, end of this week. It's already the end. And they'll be teaching next week because there are lots of holidays in November and December. So, coming to the food court, we have our food court member, Rochelle Hansen. Could you give us some insight?
So I've just been working quite a bit since our last meeting on these like reports and just assessments of the current school environments, as well as action plans for moving forward at each school, and then my own personal service plan that takes into account the various schools at both ADA, Fremont, and Union. So those got turned in at the end of October. So now I'm just really kind of starting to really move forward with things beyond just the lessons that have been ongoing since late September. So a lot of that has to do with getting into the cafeteria, so moving outside the classroom, getting into the cafeteria. I met with the food service director, Mickey, at Fremont ADA, and she was really open to monthly taste tests. So ideally, those are going to start in January and going to happen on a monthly basis. Hopefully, just featuring a certain fruit or vegetable, ideally Oregon grown, using the Oregon Harvest for Schools resource. And then hopefully, those things are sort of ongoing at Union, but the food service director out there, I think she'll be more autonomous in conducting those tests on her own. I might have some assistance there. The greenhouse at Union has begun construction, so it's very exciting. It's been quite the process to get that going. But as of last weekend, Jasco was out there getting tie downs or whatnot. They ran into some issues with supplies, but it's happening. It's going, so that's great. Plans are kind of ruminating for the raised beds and reading garden that's going to be at Fremont, just near that playground there. So I was speaking with
Raised beds and what?
reading garden is what I know it's an interesting. I haven't heard it actually before, but it's essentially just fruit trees with tables and benches and places for students to
Lots of times they'll
read
have
outdoors.
places where they do presentations relating to cooking and things like that as well.
Okay.
Yeah, I don't know if we'll have an outdoor kitchen of any sort, but that would be great. Just sort of an outdoor classroom type idea, getting kids outside. But
Charcoal barbecues. Huh?
Yeah.
no, it's good. Sure, there's enough meat around.
Barbecued corn.
So I was meeting with the teachers, trying to get a garden design in place. We're gonna actually meet with Susan to speak about that design next week, so stay tuned for how that goes. I was late. I was meeting with the Klamath OSU Extension office this morning, which was really great. I got to shadow they've had this farm to school program going on for like 7 years at this elementary school, really cool stuff going on. Sort of shadow a lesson out there and kind of see what their cafeteria looks like, take a look at their salad bar, just get some resources from them. And I think that's going to be a really productive relationship that I definitely hope to continue to foster.
That could be another place where you can have older mentors and kids together.
And garden stuff,
Yeah.
yeah.
And
Oh,
cooking.
yeah.
Yeah.
Oh, yeah, and actually, yeah, there's been some talk of trying to get, adult cooking classes going, or family cooking classes rather, at maybe the Elks Lodge even. I don't know, Luann Anderson mentioned it, so we'll see, but that might be something, to work together on. Because I think it's hugely important to get parents and kids cooking together. And that kind of goes into another piece of hoping to get more outreach to families. So there's Food Hero monthly newsletters going home each month. Every student in all the elementary schools, or the 2 elementary schools. Yeah, and that's right. Yeah, so that's cool. They have ways to shop on a budget and cook on a budget and recipes and things of that nature. So hoping to continue that outreach to families as well.
I was truly amazed to learn that for people that are often the most vulnerable and show up at food court or food share to get food, one of the problems that often that we don't think about is, and especially mothers with children that are the ones that are displaced often, when they move, they have to move on short notice. One of the last things that they actually carry out with them besides clothing are cooking utensils. And so the food share executive a year ago said they learned that anytime they make donations, they always make sure that there's a crock pot, because people don't have cooking utensils, and therefore breaking the pattern of buying junk food or not eating good food and then having multiple jobs, and it's hard to manage all that when you come home and you have hungry kids. It's easier to make something that's not as healthy. So having a crock pot really breaks,
Something, yeah.
it helps to break that pattern. And learning how to cook with a crock pot may sound silly, but it's really important. So
If you have a good quality wok, you can up too.
then you have to learn how to use it.
Yeah.
Yeah.
That's-
So it's great. Thank you, Michelle.
Thank you, Rochelle. So now our grant writer, Christy Albertson, can give us some updates on the grants that we are working on.
And the updates are kind of not much right now, although, as Paul warned me, December is gonna be nuts, January will be nuts. It's just kind of the way the cycle hits. We do have some opportunities, some small grants, which you guys are gonna talk about. The immunization, there's a little bit of money for when we're doing immunizations.
We never connected, I don't know what you're talking about.
No, some of the immunizations, so opportunity for public health and the clinics possibly to get just up to $4,000 for kind of equipment you might need to help with immunization. So I have some details that I can send you to. Yes, this is about.
Yeah, I have set up an appointment with you on Tuesday.
Okay.
Yeah. Because I guess this whole week you were in office.
We have another opportunity for our clinic that we have in Alturas to get some equipment there. Talking today, we found out this week about an opportunity possibly to help with some of our internet issues in Lake County. That was one thing that we told the folks from the Office of Rural Health and Oregon Health Authority when they were here on Monday. We have these opportunities in telemedicine and telehealth, but we have so many places in the county where we don't have the internet, we don't have cell service. There's the stigma associated with, well, I have to go to this place to get treated for mental health versus what if we can offer it in somebody's homes. So you don't, if you're talking to a psychiatrist, you're doing it from the privacy of your own home and your neighbors don't see your car at the whatever. So we have some potential opportunities there. Telehealth, you guys probably know, I'm guessing, we got a big grant from the USDA to do telehealth. Did I not know this? Mira was involved in it, so we got 97, I shouldn't know the amount, almost $100,000 anyway, to do telehealth services, and we just got the notice this week that they received our paperwork that we had to send out to them, so they're gonna start, we should be able to actually start drawing money and actually making things happen that soon. And our vendors have been meeting with the people, things have changed since we submitted this grant, taking over behavioral health, and just there have been some changes, so trying to figure out the logistics of, great, we have this money, now what the heck do we do with it? It still needs what we promised that we would do.
The money's $100,000, and then the district matches with $50,000. So for $150,000, that's a lot of money.
Mhm.
And so we committed the 50,000, USDA 100,000. So it's a
It's a
significant
really
issue.
good
And we just got that notice, so that's why.
They actually moved a
And
lot
doesn't
faster.
USDA, they offer that on a regular basis?
There's, USDA has many, many programs. This is a specific program to expand delivery of service through the use of telehealth services. So it's a specific targeted program. So it's very exciting.
We're looking at another opportunity, federal opportunity that would give us, we got it, $100,000 for 1 year to help Lake Health District partner with 3 other rural hospitals in Eastern Oregon. That we'll be talking about figuring out, if we did get this, what the heck would we do with the money? All of these deadlines are coming up really quickly. I've been working with Francie this week to figure out what money is there and what we're supposed to be doing and what we're obligated. That's part of the transition, is the health district has taken over behavioral health, figuring out what to do. The fact that we haven't had a prevention person for a while. And then I'm gonna tap you in to talk about the next, Paul, to talk about the next one that's coming up that we need the input on from the
Okay,
LCAP
I think that's our
transformation.
next agenda.
All right, good. Transition.
Were you
I'm done.
done with yours?
Yeah.
So before we jump into that one, Estella Gomez, who's our innovator agent, she's assigned to all 12 counties, was trying to call in, and we had some problems with the phone, and so she asked me just to share 2 things.
Do you want to try and call her? Is it charged up enough?
Well, she sent them to me.
Oh, she sent you,
Yeah,
so
we
you-
just said, would you share this with the group? And one of them is a new resource that's available that talks about providing services in low-income housing. So the services that are provided there, if we have areas in Lakeview, I'm not sure, we have a whole new set of things about housing coming up next year. But that's what she wanted me to share. I'll send a link to our vendor, he can get that out to folks. And the other one is, there were other people kind of like you, but I'm not sure they were VISTA people before, were they? Volunteers in Service to America?
Probably
AmeriCorps is what they were. Or the one from the U of O, rural.
Yes.
Yeah, well, anyway, the AmeriCorps VISTA post-site applications are open for spring of 2017, if you want to do that. Again, it's someone who's already graduated, I think, and they get loan payment as part of it. But they are spending 1 year full-time in service to address issues around low-income communities with a focus on public health. So those were the 2 things she wanted to share.
Excellent. And so Estella's going to send some of the links and the information.
I'll send it, yeah, I'll get that to you.
So then our vendor can send that out to everyone.
Right.
Great, thank you.
And then transitioning off of Christie's point, at the end of the presentation on the CCOs, I talked about some resources that were going to be available. And in looking at the minutes, you guys will have probably about $33,000 somewhere in there to improve incentive measures. And given the timelines that we're looking at right now, I wish that we were meeting next week because we'd know a whole lot more. So what I think we need, at least now, is a direction for a smaller group of people to work between now and December. The timing, what did I say for that? December 21st
Yes.
is likely to be the day for any submissions around the transformation grants. and they're probably gonna tie in what you're gonna do with your LCAC funds around incentive measures at the same time. So we only have one meeting and we haven't even talked about it.
I
So,
have an idea.
well, this is the time. I mean, what we kind of need is direction, Beth, and that way, and then our vendor and Christie and I and whoever else wants to participate, we'll have to do some small groups so that we can present things to the next December meeting and say, you know, can we move in this direction, finalize it, and get it in?
Well, I was just at a conference, and the Director of Public Health from Baker
Yep.
County was there, Karen, and she was talking about, and you had touched on it when you were here before, what Baker County does to do their adolescent well child visits. They do have a huge collaborative that they do once a year. And I feel like the doctors here have always been great about, they volunteer to do sports physicals for the kids, but you're just hitting a few of the, you know, that adolescent population. And so what they did at Baker is that a similar thing, but it was all the middle school, all the high school kids, and they expanded it. So it's not just sports physicals. They did a mental health screening, the alcohol screening. They did, they had a public health visit. They reviewed their immunizations. They got information on birth control or, you know, sexuality, whatever, abstinence, whatever that sort of information is that they needed. A dental screening. I mean, it was comprehensive. And they did fun things like they have, OSU has a bicycle, the smoothie bike that you ride and it makes a smoothie. And so they had, you know, that there for the kids. And they had a cool painting with letters on, and the kids, everybody who participated got to do a handprint in paint on this, and then they took the letters off and it was like, be brave, be strong, be healthy, or something, and they hung it in their schools. Anyway, it just sounded really great, and they had great participation. I don't know what the numbers are up there, do you?
150,
Well,
wasn't
Baker,
it?
they had it.
I want to say 141
Yeah.
is what they got through. And that may not sound like a lot, but that meets the adolescent well visit incentive measure, which we did not meet last year.
And
And
then,
they had a little movie in there for
Yeah,
it
they
too.
they had a thing on
Fortune
Hudson
tellers
Drive.
and-
You know, they had stations about, yeah, they had
did they
a
have
fun
Nolan Nicole in there?
No,
movie.
no, that was a separate event.
I think they did it on campus.
No.
Wasn't it
Baker?
Yeah, they
No,
didn't do it on
it was in
campus.
the park right behind the library.
Oh, okay, it was
Yeah,
right in
Central,
town.
that's-
So it was an outdoor event.
Yeah, in the
And they did it
early
during-
summer evening.
They did it during registration.
And the key thing here is the providers refused to they wouldn't do sports physicals. It had to be the well child visit, which included a sports physical. They couldn't
Yeah,
just
so
do
it met the
sports physical.
requirements for the sports physical, but it was just a lot more comprehensive than that.
So they had all the providers in Baker unified in that they couldn't just come to their clinic and do sports physical.
And I think they even had buses running, didn't they, from some of the outlying communities?
That I couldn't tell you, but I can give you the whole program through, because the
Yeah, I could
CAC worked with Public
Yeah.
Health. Public Health was the
Yeah.
organizing.
Yeah, I'm not sure if they got it this time. I know the next time they're planning on doing it because they realized they can use the exchange for that to happen.
So here's what I think before we run out of time. What this says, when we look at this chart, so these are the measures that we need to be thinking about. Okay? So let's take this one, effective contraceptive use. Some measure that is evaluated from claims that are generated by patients coming in to be seen in the clinic, no matter where, whether it's Northlake, here, or at Warner Mountain, wherever. So, we look at Lake County, it says two things. We were 16.5%. The goal, the current status for everyone is 25%, 24.5. Our target is 42%. So we are way below what our target, and this little arrow here says our direction from last year is going down. So we're doing worse. So when we look at how Lake is doing in comparison to other counties, we have 1, 2, 3, 4 in the red, and there is no other county that has 4 in the red.
We don't have any men.
We don't have any in green. The others are in yellow. So we have some money that we're gonna be able to get to help us address some of these things. Adolescent well visits, we were less than we were at 8.5%. We need to be at 30%. We got a lot of work to do. We gotta figure out how to help our doctors. Now, last year, if you recall, one of the things that we volunteer, or we have been doing, is if any adolescent shows up in the clinic, they get a iPad, or iTunes card. Because they can't go by themselves. You know, a 12-year-old can't go to the doctor and say, "Hi, can I be seen?" But if they bring their parents, or get their parents to bring them, you get an iTunes card. I don't know, maybe some kids like that, some don't. But what they also get is the chance to be in a lottery to win an iPad. Not a bad deal, is it? How many people have iPads? Okay, well, see. If you were an adolescent, you could get your parents to take you in and get seen. That kind of deal.
I think in Baker, they handed out movie passes.
Our movies.
I know.
You'd have to hand out the Netflix card.
Problem with us, we don't have a movie theater.
They
They're
raffle
working on
off
it.
the bicycles in Baker too.
So what we really need to
Oh,
do
they did
before we
something.
close up today is anybody that's interested in meeting next week with our vendor to try, and we'd probably get some of our other staff, to focus on any one of these. Because we've got to figure out how to change this. Because frankly, we're not doing as well as others.
Yeah, I would just like to add one other goals of the Youth Health Advocates program was that once the class was taught, the advocates were handing out the well-care visit forms to the students, and if they go to their nearby clinic and give them the form, their name gets checked, and their name gets entered into a raffle draw in which they can either win an iPad, an iTunes card, or I guess there was one more gift card that is provided to them. So yeah, so that's another way that we are trying to raise
Right.
the well-care visit numbers.
I think one of the cards was you can get stuff at one of the local Lakeview stores. So that if you went to True Value or went to the 39er or something like that. But
I would just add though, Charlie, that the people who kind of look at our success on this are at the Oregon Health Sciences University. So they're a third party that kind of advises us on, you know, who to fund on grants, because if we'd be reading our own grants, so we need arms like, but they are definitely going to be suggesting not to spread it too thin, not to go after too many measures. You know, they'd rather say do a good job on 2 of them than try to address 7.
I didn't say we were going to address all of them.
No, no, no.
We need to figure out how to spend some.
Well, I'm just suggesting that we'll start thinking about
Great idea.
narrowing it down. So really, well,
Is this on the transformation list?
no, this is on the
incentives.
incentives.
So, the areas that we need to work on, almost all of it is related to kids. Not all of it, but a lot of it. I mean, our emergency room.
You're doing
usage-
good there.
Pardon me?
You're doing good there. Lower's better.
So, we're doing good here, but our colorectal screening, we're not doing so good. Now, everybody wants to go to the doctor for that, right? I don't think so. But most of the others are designed around either adolescent or young adult. So ESPERT, timeliness of prenatal care, effective contraceptive use, adolescent well care. We're focusing on our dental sealants right now. But do I have any volunteers? Or are we gonna make our vendor do it all himself?
Oh, yeah.
When's your meeting? What time and what day? Were you talking about it?
No, for trying to come up with monies sometime next week, because we've got to have an answer back to the CCO.
December 21, maybe.
Yeah.
By then?
That's Ted, that's,
Deadline.
there's a meeting tomorrow that's gonna finalize that. I'm trying to get this one versus the grants pushed back 1 month, but I can't say that I'm gonna get that, so.
So between now and the next CHIP meeting is gonna be in December on the 8th. So between now and the 8th,
Okay,
any volunteers?
Question, so the purpose of the meeting is just to select some of these to focus on, or then to
Now,
also
if we had
come up with ideas?
$35,000, and we were gonna try and do something to make an impact on any one of
Okay,
those.
okay, like programs.
Yes.
So if we said, all right, let's talk about effective contraceptive use. And we wanted to get out and get a whole bunch of adolescents to come in and have their practitioner talk to them about effective contraceptive use.
That's all women of childbearing age, Charlie, I'm not targeting.
And they have to be using a method, not just talking about it.
yeah.
Okay, there you go. So
So,
all the
yeah.
criteria.
It's-
So the idea would be, how would we, the purpose of the group meeting is to talk about ways to encourage that to occur.
Yeah.
Same thing with timeliness of prenatal care,
And to decide which one we thought our community should be focusing.
one or two.
Yeah.
And then if we had $35,000, what would we do with that to change those numbers?
What's Asbert?
Screening, brief intervention, and referral to treatment. It's alcohol and drug screening that should
Okay.
happen at just about every, and obviously it's not here.
No, it's not.
At one
No,
point.
what's happening is it's not
1.6.
being documented.
Okay,
One of the things about all of this does not say we don't deliver that service. It means we don't document in our billing correctly.
So as part of what you need to do is the educating those that need to document.
yeah, but that's not good, the paying for that wouldn't fly. I mean, that's,
No, but it could be certainly included in your plan.
yeah,
Yeah,
But isn't it when you, with electronic health records, when you have a visit and you're clicking on each thing that you're doing, each service you're providing, it's compiling that to say, well, that just met an adolescent well-child visit. But if you left out one component of that adolescent well-child visit, you might have done 9 of the 10 items that are required, but it's not gonna register as an adolescent well-child visit, even though you completed most of it.
You're absolutely right. And
Yeah,
part of
so-
what has sort of been a little bit of an impact for us is when we took over Lake County Medical Clinic a year and a half ago, they didn't have an electronic record system. So now we have changed that, and they do have an electronic record system. Warner Mountain Medical Clinic does have an electronic record system, and they are doing this. They're impacted by this also. So that's a big part of it, is making sure that staff are asking those questions.
Well, yeah, that they know what they have to ask to meet that requirement and fulfill that.
So rather than, because time is ready to
Yeah.
go, maybe what we can do is, when our vendor will send out some possible dates of meeting between the next 3 weeks.
yeah.
If you are available and would like to participate, please let him know. Okay?
Yeah.
Our
They
next-
can call me.
Marvelous, thank you. Thank you.
Yeah.
The next meeting will be on the 8th of December. Do we have any other issues that we need to bring up to keep us, that we should be talking about? Perfect. Any other questions or issues that anybody would, Paul?
I have a question. Christie, what happened to the grant that Mira submitted that had to do with the tablets? It didn't get funded.
It didn't get funded, that's
Okay.
correct.
Well, it was, so that when people in public health or in the early learnings were actually doing the developmental screens, they could immediately contact somebody at primary care using the tablets and the technology that we talked about through the USDA and say, okay, here's the visit. There's a big project for you.
We thought it was gonna be a great plan. The evaluating committee didn't quite agree.
You mean, it was submitted though, right?
It was
Yeah.
submitted.
Okay,
Yes.
all right.
went to the CC. It was not.
No, that wasn't to
No,
us.
it went to the Office of Rural Development,
Oh, that's it,
and they did approve that.
so.
Okay.
If you have business cards you'd like to share with me, great. If you or your agency would like to be a part of the Older Adult Health Collaborative, please let me know too. I may be contacting you anyways. But we would be looking at meeting more than likely
The other thing, Charlie, these aren't all 17 of the measures either though. So some of them are clinical indicators. One of them is controlling hemoglobin A1C levels in diabetics and high blood pressure. You guys have identified obesity and physical activity as something that you wanted to do. You know, you can link those incentive measures back to back to a project that you want to do. So keep that in mind. I mean, people have talked about living well with chronic illness, getting people into that, if you had it.
We're so close, we are so close.
Well, we have had it before, and it's too restrictive. It requires too many
time.
people.
6
It's too much
weeks
time,
and-
it's 12 weeks, and it
So it's
has to
six.
be 6 people. We've had it offered here before, and
You also have.
But if you had incentive measures, then you could pay people to go.
I don't know, people have not been very positive about that particular program. And we tried to collaborate with OSU when they were doing it and see if we could, like, do it with less numbers, because I think you have to have
Okay.
6 participants. We said, can we do it with 3
Yeah.
and get it going and see how it
Right.
goes?
And I was also telling
They would let
Christie
us-
that the community health workers can bill for providing that training too.
Yeah.
So there's a little more sustainability built in.
Well, we found somebody with a grant that has this covered here that would be interested in coming in.
And this is what,
I mean, you can try it, but in the past, when it's been offered, they can never even get 6
Can't
people
get
to
6
sign
people
up.
to come.
We need to tie it in with something else.
Right.
But there's other items
Did they
besides
get
those
enough
that this
people?
group can
So,
talk about.
What we'll do is we'll send out,
Fizzled out.
Yeah.
when our vendor sends out invitations to saying people that they're interested, whether it's a doodle poll or whatever in available times, they'll include the whole list of the 17 items. So if you're interested and willing, we'd love all your help. Any other questions that you want to go over? Thank you very much for coming. This has been very, very good. Appreciate it.
What we did, where I